Hello, welcome to Denver Health. We have a movie to show you about two kids who are having surgery. Gabby is a 9-year-old patient who came to the hospital for surgery, where she had to spend the night afterward, and Jake is a 6-year-old patient who came for surgery who will not be spending the night. We want you to know what to expect when you come here for your surgery, and we are excited to meet you. This is the Davis building located on the main campus of Denver Health. And this is Jake. He and his mom are meeting with Dr. Eusterman, one of our pediatric ear, nose, and throat doctors. Hello, Dr. Eusterman.
Jake, my man, how are you? Why are you here today? You're gonna have your tonsils out. Okay, you're going to surgery. They will take really good care of you. Okay? You know where your tonsils are? They're back in your throat. They've been giving you some infection.
At your appointment with the surgeon, the nurse will talk with you about when you have to stop eating and drinking, the date of your surgery, the things you should bring, and where you need to go.
Okay, we'll see you at pre-op.
It is very important that you follow the instructions the nurse gives you. The rules about eating and drinking are called NPO instructions. You may hear that word. Parents, please make sure you understand when your child needs to stop eating and drinking before his surgery. This is Gabby, a 9-year-old patient who is coming to Denver Health to have surgery, where she will be spending the night afterwards.
Hi Gabby, I'm Dr. Bensard, and you're going to have your surgery. Did you bring a suitcase so that you can spend the night with us?
At Gabby's doctor's appointment, she and her mom also learned everything they needed to know about her surgery. The nurse gave them specific instructions about when to stop eating and drinking, the date of her surgery, where to go, and what to bring.
Did you bring your homework? No. You didn't bring your homework?
Jake is arriving at Denver Health for his surgery. He brought his mom with him. They have to check in at security and then go to the registration desk.
Hey, how you doing?
We're good, thanks. This is Jacob Brown. We're here to register him for surgery today.
Okay, my name is Francisco. I'm going to be registering it.
Great, thank you.
I need to verify your name and date of birth.
Jake Brown,
Okay, and when is your birthday?
May 14th, 2005.
That's right.
Let me put this on you.
A nurse came down to take Jake and his mom upstairs. Now Jake is in the pre-op area where he will wait before his surgery.
My name is Michelle. I'm going to be the nurse checking you in today and getting you ready for your surgery, okay?
During this time, he will meet his nurses, doctors, and other people who will help take care of him.
This goes on your arm just like this. Good. Okay. This one's going to go on your finger. See that red light in there? Good job, sweetie. I'm going to check your temperature. It might tickle just a little bit, okay? Ready? Here we go. Did that tickle? Good job. Excellent. We're going to take really good care of you today, okay? If you or your mom have any questions, just let us know, okay? Sure.
Now Gabby is arriving at Denver Health for her surgery. She had to come in very early. Gabby's mom is with her this morning. They have to check in with security and get registered as well. She is now waiting in the pre-op area, just like Jake.
Hi, Gabby. I'm Debbie. I'm your nurse today. How are you?
Good.
Good? Okay, I'm just going to do a little bit of set of vital signs on you. I'm going to put this on your finger. That's just going to tell me what your heart...
When the nurse checks your oxygen, she puts a red light on your finger. It looks like a Band-Aid. It doesn't hurt. Then she takes your blood pressure. We call it a muscle tester. This wraps around your arm or leg. It squeezes really tight. Your job is to stay still. Then she will take your temperature. All of these are called your vital signs. After the nurse takes your vital signs, you may meet someone called a child life specialist.
Hi, Jake. I'm Erica. I'm kind of like the teacher here. How you been? Are you doing okay?
Yeah.
Yeah, cool.
Hey, I have this really cool book to show you. I want to talk with you about what's going to happen today. My job is to make sure that kids understand. Can I show you something really cool?
She has toys and activities for kids while they are waiting, and she talks with them about their surgery.
Can you blow bubbles for me? Show me. Ready? Blow. Oh, you are so good at that.
She helps kids understand how things will go on the day of surgery to help them feel prepared. The Child Life Specialist will also spend time talking with your family about what to expect for the day. If you have any questions, she is a great person to talk to. She helps kids and families have a good experience.
Can you do that? Okay. Sounds like a deal.
You will meet your doctors in here. There are lots of doctors at Denver Health. It is a teaching hospital, so some of the doctors are in training. One of the doctors you will meet is an anesthesiologist. That is a very hard word to say. They are in charge of the sleepy medicine.
And we can make it smell really yummy with your favorite scent if you'd like.
When you have your surgery, these doctors give you medicine that makes you fall asleep. A special medicine sleep that is different than sleeping at home. The sleepy medicine helps you not feel anything.
Ooh, nice. Good job. So when we get into the operating room, you just need to blow like you're practicing your bubbles, okay?
You will also meet your surgeons in here. He or she will check on you before your surgery to make sure all of your questions are answered. And the last person you will meet is the nurse who will be taking care of you in the operating room.
We wear our masks so we don't get our germs on you. The next time I'll see you, I'll be in the operating room, okay?
You're fast.
Thank you.
Gabby is coloring while she waits. She will meet all of the people who will take care of her too. Remember, there are lots of nurses and doctors here who will meet you. Just like Jake, Gabby will get her sleepy medicine through a mask. Now it's time for Jake to go to surgery. His bed has wheels. The Child Life Specialist is going with him into the operating room. She had to put on a white suit, a hat, and a mask. We call them bunny suits. This is what the operating room looks like. There is a bed in here, a pillow, and big lights on the ceiling. There are also monitors, computers, tables, and chairs.
And I have your mask that you did the bubble game. I'm gonna put that right over your nose and mouth. It's not gonna hurt. Just take some nice big deep breaths, like when you're blowing the bubbles. Good job. Big deep breaths.
The doctors have everything they need in here for your surgery. The nurses help the doctors take care of you. Remember, your job is to breathe through the mask. That is how you get your sleepy medicine.
Deep breaths as you go right off to sleep. Good job.
When Jake's surgery is finished, his mom will be with him in the recovery room. Sometimes we call it the wake-up room.
My name's Michelle. I'm going to be taking care of you while you're here, okay?
Here's Gabby again. Her surgery is all done too. Gabby's mom is sitting with her while she is waking up now.
Well, oh, there you are. Oh, wake up slower. There you go.
Both Jake and Gabby are in the recovery room. This is where you go when your surgery is finished. Your mom will be with you while you are waking up. Once you are awake, the nurse will give you something to eat and drink, like a popsicle and juice or water. She wants to make sure you are feeling good before you leave the recovery room. When you wake up, you may have an IV. An IV is a small medicine tube that the doctors put in your hand or arm. They use the tiny little tube to give you medicine. You get your IV while you are sleeping so you won't feel it. The nurse will take it out before you go home. When you wake up, your throat might feel a little scratchy and you might have an oxygen mask on your face. Oxygen is fresh air that blows close to your mouth and nose to help you wake up.
As soon as she starts waking up a little bit more, then we can take this oxygen away a little.
Jake is eating a popsicle waiting to go home. He can even watch a movie while he waits. The phone number to the recovery room, if you need anything after you leave, is 303-602-1020. Jake is getting his IV taken out, and then he will be ready to go home. Bye, Jake.
Bye.
Bye.
Come on.
Gabby will be spending the night at the hospital. The doctors want to watch her overnight to make sure she is ready to go home. She will stay in the recovery room just like Jake, and then she will go to a room on our pediatric floor.
Hello, this is Debbie from the PACU. I need to speak to whoever the nurse is for Gabby. She's in the wake-up room, and we're just wanting to know if you're ready for her yet. Okay, we'll be coming up shortly. Thank you.
This is Gabby's room in the pediatric unit where the rooms are so nice. This is where you will spend the night. You will get to eat lunch and dinner here, and it's okay for your family to visit. At Denver Health, we have 2 playrooms. The Starlight Therapeutic Playroom has activities, toys, and books for kids to use while they are here. We also have the Child Life Zone. The upstairs zone is a special place just for kids who are in the hospital to use. It has all kinds of activities, including video games and rock band.
Hi, Gabby. I'm Claire. I'm going to be your nurse this morning. How did last night go? Good. Yeah? Okay, good. The doctor actually said that she can go home this morning, so there are just a couple things that I'm going to do before she goes home. Okay, thank you.
Gabby has to get her IV out before she leaves. She doesn't need it anymore. Good job, Gabby! Well, that is the end of our movie. We hope it has helped you feel better about your surgery. Although nobody wants to go to the hospital, just remember that everyone there will be taking very good care of you. Everyone knows the best part of having surgery is going home. Bye! Again, parents, please make sure you understand your child's instructions about when they need to stop eating and drinking. It is very important that you follow the instructions the nurse gives you. Again, the rules about eating and drinking are called NPO instructions. Please make sure you understand when your child needs to stop eating and drinking before his surgery. Remember, if you or your family have any questions about anything, you can call 303-602-1021.
Visit denverhealth.org to learn more. Denver Health, Level 1 care for all.